She sat in my office on a Tuesday afternoon, holding a folder of test results that had all come back clean, every single one of them. 3 months earlier, she had walked into her primary care physician's office with 3 complaints that seemed small on their own. She was tired, more than usual. She had lost a little weight without trying, and her bathroom habits had quietly changed. Her doctor told her it was probably stress, maybe her age. She was 68. They ran a basic panel, shook hands, and sent her home. What they missed that day cost her dearly. I'm Dr. Alan Miller, and after 18 years in senior health and wellness, with a particular focus on age-related conditions, I've seen firsthand what happens when these warning signs go ignored. Here is what I need you to understand before we go any further. The 3 symptoms I'm about to walk you through are not exotic. They are not rare. They are, in fact, some of the most commonly reported experiences among adults over 60. And that is precisely the problem. Because when something is common, it gets normalized. It gets filed under getting older. It gets dismissed. And when it gets dismissed long enough, something that was entirely treatable becomes something that is not. By the end of this video, you will know exactly what these 3 symptoms are, why your body produces them, how they differ from their harmless lookalikes, and the specific steps you need to take, today, not next month, if any of them sound familiar to you. Before we begin, I want to say this clearly. Nothing in this video replaces the guidance of your own physician. Please do not change, start, or stop any treatment based on what you hear here. What I want to give you is the language, the specific, informed language, to have a better conversation with your doctor. Because the patients who get caught early are almost always the ones who pushed, who asked the right question, who refused to accept "you're probably fine" without a specific explanation. Now let's talk about why these 3 symptoms get missed, and more importantly, why that is not your fault. The average primary care appointment for an older adult in this country lasts between 15 and 18 minutes. Think about that. 15 minutes to review your blood pressure, your medications, your labs, and anything else you've been meaning to bring up. In that environment, a symptom that sounds vague, "I've just been really tired," gets triaged quickly. It gets assigned a plausible explanation: aging, anemia, poor sleep, and the appointment moves on. It is not that your doctor doesn't care. It is that the system is not built for nuance. And these 3 symptoms live entirely in the space of nuance. Here is what changes everything: understanding the mechanism, not just what the symptom is, but why the body is producing it. Because once you understand the mechanism, you realize the symptom is not vague at all. It is specific. It is telling you something exact. And you will never again accept a dismissal without asking the right follow-up question. Let's start with the first symptom. Symptom 1. Fatigue that is different in a way you cannot quite name. I need you to think carefully here, because the distinction I'm about to make is everything. There is the tiredness that comes from a poor night of sleep. There is the fatigue that follows a busy week, a stressful month, or a season of poor eating. Every one of us knows that kind of tired. You rest, and it gets better. That is normal. That is your physiology doing what it is supposed to do. The fatigue I am talking about is different. It does not respond to rest. You sleep 8 hours and wake up feeling as though you did not sleep at all. You sit down in the afternoon, and the heaviness in your body feels like something pressing on you from the inside. It is not sadness. It is not depression, though it can be mistaken for that. It is a physical weight that simply will not lift. Here is the mechanism. Certain cancers, particularly blood cancers like lymphoma and leukemia, but also lung, colon, and kidney cancers, trigger the release of proteins called inflammatory cytokines. These cytokines are part of your immune system's response to the presence of abnormal cells. One of their most consistent effects is profound, unrelenting fatigue. At the same time, some tumor cells are metabolically voracious. They pull glucose away from your normal tissues at a rate your body cannot compensate for. The result is a system-wide energy deficit that rest cannot fix, because rest is not the problem. The source of the drain is the problem. Let me tell you about Gerald. He was 71, still active, still out in his garden every morning. He started telling his wife that his body felt heavy, not sore, not sick, heavy, like he was carrying an extra 20 pounds that wasn't there. He came to me 6 months after it started because he had been sure it would pass. His basic blood work looked acceptable, but I noticed his white cell count was creeping, still within range but trending. We dug deeper. Gerald had early-stage lymphoma. We caught it at a point where treatment was highly effective. He told me later that the word heavy is what saved him, because it was specific, it was different, and he refused to let it be explained away. Stay with me, because what I'm about to tell you about the solution is something you can do before you leave the house today. If you have been experiencing fatigue that does not improve with adequate sleep, and I mean genuinely adequate sleep, not fragmented or shortened sleep, for more than 3 consecutive weeks, that is a red flag worth reporting. When you go to your doctor, do not say, "I'm tired." Say this: "I've been experiencing persistent fatigue for 3 weeks that does not improve with rest, and I would like a complete blood count, a ferritin level, and a CRP included in my workup." Those 3 tests, CBC, ferritin, and C-reactive protein, give your physician a window into whether something inflammatory or hematologic may be driving what you feel. Symptom 2, unexplained weight loss. I need you to hear this directly. Losing weight without trying, without changing your diet, without increasing your activity, without any deliberate effort, is not good news. I understand that in our culture, weight loss is often celebrated, but unintentional weight loss in an adult over 60 is a clinical red flag until proven otherwise. The threshold that oncologists and internists use is this: 5% of your body weight over 6 to 12 months without any intentional effort to lose it. For a 160-pound person, that is 8 pounds. For someone who weighs 180, that is 9 pounds. Quietly, without drama, across the course of a single year. The mechanism behind this is called cancer cachexia, a complex metabolic syndrome in which a tumor sends chemical signals that fundamentally alter the way your body processes nutrients. Your liver begins converting muscle protein into glucose to feed the tumor. Your body stops efficiently absorbing dietary fat. Your appetite regulation changes at the neurological level, so you may not even feel hungry. The result is a slow, steady loss of both fat and lean muscle mass that continues even if you are eating adequately. The tumor is not starving because you are not feeding yourself enough. The tumor is redirecting your fuel supply. Let me tell you about Barbara. She was 66, lived alone, and assumed the weight she was losing, about 1 pound a month for most of the year, was because she was eating lighter. She felt fine, mostly. A little less energetic than she used to be. Her clothes were looser. Her neighbors told her she looked good. She did not see a doctor for nearly 8 months after the weight loss started, because nothing about it felt like an emergency. When she finally came in, the imaging told a story that the scale had been whispering for almost a year. Pancreatic cancer, caught later than it needed to be. Not because Barbara was irresponsible, but because nothing about the weight loss had felt dramatic enough to act on. The solution takes 30 seconds a week. Weigh yourself on the same scale, at the same time of day, on the same day each week. Keep a note of it, in your phone, in a notebook, wherever works for you. If you notice a consistent downward trend you cannot attribute to deliberate changes in diet or activity, report it. Write the numbers down. Bring them to your appointment. And if your doctor does not recommend imaging, ask specifically. Given this trend over time, should we consider abdominal imaging to rule out a structural cause? You are not being difficult. You are being thorough. And being thorough is how people survive this. Symptom 3. Changes in bowel or bladder habits that persist beyond 4 weeks. This is the symptom people are least likely to bring up. I have had patients who waited 6 months to mention it because they were embarrassed. I need you to set that embarrassment aside right now. Colorectal cancer is one of the most treatable cancers in existence when it is found early, and one of the most devastating when it is not. Here is the mechanism. As a tumor grows inside the colon or rectum, it can partially obstruct the passage of stool, alter the speed of transit through the bowel, and trigger localized inflammation that changes the character of what the body eliminates. The result can look like new or persistent constipation, straining where you never used to strain. It can look like unexplained loose stools, or a feeling of incomplete emptying after a bowel movement. You may notice a change in the shape or caliber of your stool, narrower than it used to be. And there may or may not be visible blood, which can appear bright red or, more commonly, remain invisible to the naked eye. Similarly, changes in bladder habits, increased urgency, blood in the urine, or pain during urination that is not explained by an infection, can be early indicators of bladder cancer, which is significantly underdiagnosed in older adults, particularly in men. I had a patient named Howard. He was 74, a retired engineer, sharp and observant. He noticed over about 2 months that his stools had changed in consistency. He brought it up almost as an aside at the end of an appointment scheduled for his cholesterol. The last thing he mentioned, almost apologetically, but it was the first thing I followed up on. A colonoscopy 2 weeks later found a polyp that had already begun its transformation into something more serious. We removed it. Howard is fine. And he told me afterward that he almost didn't mention it at all. The bathroom, he said, felt like too private a thing to bring up. Nothing is too private to save your life. The solution here is concrete. If you experience any change in bowel or bladder habits that persists for more than 4 weeks, it warrants a conversation with your doctor. Not 4 months, 4 weeks. For bowel changes specifically, ask about a fecal immunochemical test, an FIT test, which detects hidden blood in the stool that you cannot see yourself. And if you are overdue for a colonoscopy, this is your signal. The current recommendation for adults over 45 is screening every 10 years, or more frequently with a family history of colorectal cancer. If your last colonoscopy was more than a decade ago, pick up the phone this week. I want to come back to Dorothy for a moment. Dorothy's 3 symptoms, fatigue, weight loss, and a change in her bowel habits, each seemed individually explainable. Stress, aging, a dietary shift. But together, they were telling a story. A complete, coherent, urgent story. And that story didn't get read until it was much harder to rewrite. She fought hard. She is still fighting. But she told me once, and I have never forgotten it. She said, "I wish I had gone back. I wish I had pushed." And that is exactly why I made this video today. For you. Here is what I need you to take from today. First, track your energy. If you have been tired in a way that rest does not fix, for 3 or more consecutive weeks, request a complete blood count, a ferritin level, and a CRP test. Name those tests specifically when you speak to your doctor. Second, weigh yourself weekly. Record the number. If you see an unintentional loss of 5% of your body weight over 6 months or less, bring those numbers to your doctor and ask whether imaging is warranted. Third, pay attention to what your body is telling you. Changes in bowel or bladder habits that last longer than 4 weeks deserve a conversation. If you are overdue for a colonoscopy, schedule it this week. And fourth, do not accept dismissal without a specific explanation. You have every right to ask, what makes you confident this does not require further investigation? A good doctor will welcome that question. A great doctor will already be answering it before you ask. These symptoms do not arrive with sirens and warning lights. They arrive quietly, in the ordinary fabric of daily life, disguised as nothing more than aging. That disguise is exactly what makes them dangerous. And now you know, not just what to look for, but why your body produces these signals in the first place. You are no longer at the mercy of a 15-minute appointment. Knowledge is the difference between catching something early and catching something too late. And today, you have the knowledge. I want to ask you something before you go. Of these 3 symptoms, the fatigue that rest can't fix, the unexplained weight loss, or the changes in bowel or bladder habits, has any one of them felt familiar to you or to someone you love? Tell me in the comments below. I read them, and your answer matters more than you know. If someone in your life needs to hear this today, a parent, a spouse, a neighbor, a friend, please share this video with them. Not as a scare, as a gift. The kind of information that might give them the window they still have. In our next video, I'm going to show you the specific blood tests that every senior should be requesting at their annual checkup, and the ones most doctors won't order unless you ask for them by name. That one could change everything. I'll see you there.